is one component that I think is an integral component of quality, and that is compassion, because we are human beings. And my question to you, how do you think compassion can be impacted as we adopt more and more using chatbots in healthcare?
Well, I had a very interesting conversation with this a while ago, and I would just repeat it. So there's a guy called John Madison, who's one of my heroes, who was a Kaiser Permanente for many years. And he said the point where you're going to see this arrive is eventually this technology will fade into the background, and that will give the human-to-human interaction the space to breathe. So I would take one teeny example, and Ali actually brought this up. Ali said, hey, when we have our system, we can take a bunch of information from the patient that saves time because they don't have to tell it directly to the doctor again. And there was, I believe it was Brigham and Women's, or one of the places which has started using a lot of telehealth very recently, said in fact they were having trouble because typically when a patient arrived in the exam room, a nurse or a physician's assistant would go, or a tech would go in and take the temperature and do the blood pressure. And this stuff would just be sitting there waiting for the doctor when the doctor walked in. And instead, the telehealth visit starts and the doctor goes, okay, what's your temperature or whatever? And I have my little blood pressure cuff here, and I can imagine spending some time blowing it up and then going, is that the right reading? And no, there was an error. And this was actually wasting time of the doctor. So if these readings, and not just, by the way, the point in time reading, but the trend, are you up or down? There are some things where it really matters point in time. If you have COVID and your oxygenation rate falls rapidly below sort of 70 or 80 or whatever the number is, that really matters right then and there. But if you're way out of line in your blood glucose, yes, that can be a big problem. But for most of this stuff, it's where are you in a range? And are you going to be measured and monitored consistently over time, so we can see where the exceptions are and where you're trending. And I think that the shift in the sort of humanity aspect of this is going to be, we're going to take a lot of the technical work away from doctors, technical recording, not the very complex technical work of surgery or the very complex technical work of understanding the progression of disease, but the bit about how do you talk with people about their condition in an empathetic way, explain to them what to do, and then use that sort of human factor to help them make the right decisions. Because a lot of what we're talking about in this use of AI is, can I figure out when it is that Matthew, who is trending towards diabetes because he eats too much and doesn't exercise enough, is going to have an ice cream? Is it some behavioral thing? Is it just he likes ice cream? We need to get him to keep it out of the house. What do we do? How do we help people in those areas? And if you look at companies who are spending a lot of money in the behavioral health area, or trying to do behavior change, not just behavioral health, folks like the Livongos and others, they're really focused on how do we make those impacts that change, that we can understand how to change people's behavior. But that's going to have to come through a human filter. And all those companies that have been successful are using not the doctors to do the first line of call, but Ali mentioned like it's somebody as a human being who has to explain it to you. And there are times you're going to need to have a human being explain to you something to you that perhaps you could have gathered from a machine, but you need that human contact. And I think the increase in the level of sort of trained empathy that all people in healthcare are going to require is going to be massive, because we've kind of trained that out of people in healthcare in the last few decades, and we need to get it back in.
Yeah. Thank you for the insight, Matthew. So I want to go back to Ali and follow up on what Matthew said. So do you envision health chatbots of 2025 to be more intelligent than today's health chatbots, and in what ways?
Ahmed, you and I come from the Middle East, and in the Middle East, we have a wonderful saying, which is, if you want God to laugh, you give her your 2-year plan. The truth is, none of us know how things go. There was time in history where, human progress actually took a back step. It didn't go forward, right? It took, when the Roman Empire, for instance, fell, it took almost 1,000 years to go back to the same level of production of ore than they had before the fall of the empire, right?
Not in the Middle East, Ali, right? The Middle East kept going. It was the Europe that collapsed.
Correct. Middle East did very well, and then after the advent of Mongols and others, that had its own challenges, right? So I think we these things are hard to predict, but you would have thought, assuming everything continues going the way it goes, the technology of 5 years from now will be in a fundamentally different place than the technology of today. And yet, you may see setbacks. You may see, and some of those setbacks may have nothing to do with regular technology. It may be regulatory. It may be others, right? Or you may see what we just saw with COVID, which was a incentive, an imperative to fast forward the growth of technology. I actually believe that if you had asked me about the growth of telemedicine 6 months ago, in my wildest dream, I would not have told you where we are today. And because the problem was never technological, the problem was always cultural, right? The problem was always cultural. And now, with AI, the problem is technological. It's not just cultural. All of us use AI all the time without question. Without question, right? I mean, I have a PhD in physics, and when I talk to my 17-year-old who's doing physics, and I explain something to them, they Google it, and they say, sorry, Dad, you're wrong. Right, here it is, right? And they change. And what does Google done? It's just a piece of AI that has found the most relevant answer for them. It doesn't make that answer correct, but in their mind, that is more correct. You and I will follow a map on Google on our thing to the end of the world, and we just assume it's going to be right. And if somebody sits next to us and say, no, I know this road, don't listen to this map, this is better, we say, no, you don't know about the traffic, this, that, the other, I'll follow the map, right? So I actually think in so many areas in our life, we are following AI with no problem at all. The problem is the AI takes a long time to become good, but when it becomes good, it's going to be good. It is mind-boggling how wrong people get stuff, right? I mean, there is a guy who spends a huge amount of time, one of my favorite kind of people, because these people act as massive alert system for us. They test our products to destruction, trying to find what is wrong with it, and then they alert us by putting it on Twitter. And so I think people should, instead of being defensive about people who criticize them, they should say, look, don't ask where is somebody wrong. Ask what part of what they say is right? And then focus on that part and fix that part and move on, right? And that way AI will become much better. At the moment, there's too much worried about defending your position. And it's just, I mean, I was a failed scientist. I mean, in science, you don't defend position. You try to discover the better solution by listening to everybody's point of view.